Unfortunately, the world we're living in is getting more and more toxic with chemicals and heavy metals and radiation. And so one of the areas that I really like to focus on is environmental medicine, which is treating conditions that are caused by exposure to certain environmental toxins. So we treat a lot of heavy metal toxicity, for example, mercury, lead, cadmium, and things like that, as well as a variety of different chemical toxins. It's impossible to avoid these toxins in our environment, and yet if we know that they're there, we can treat and remove them, and also guide people to better avoidance so that we can at least reduce our exposure. For example, cadmium and lead are two metals which are common causes of hypertension or high blood pressure. And oftentimes if I get a patient in who's done all of the lifestyle changes, they've lost weight, they've reduced their salt, they exercise regularly and they still have high blood pressure, I will absolutely check them. And I have never had a patient in that situation who has not come back positive for lead or cadmium. The great thing about that is that they're easy to remove. Another thing that we really want to focus on are some of the what we call bioaccumulative toxins. These are things like pesticides that build up and stay in your system over the long term, and they can really set the stage for the development of cancer, chronic neurological conditions, and a variety of other diseases. And yet those too can be removed. And so if we know ahead of time that there's what we call an excess body burden, if there's too much of those chemicals in someone's body, and we can remove them, we can hopefully prevent those conditions from ever happening.